Welcome to a special Frontiers Health episode of the Pharma Forum podcast. This is your host, Nicole Raleigh, and in order to mark the 10th anniversary of Frontiers Health, Pharma Forum is running a short series in the run-up to November, speaking with experts in their field about their favourite memories from the conference over the past decade and the future of health more generally. In this episode, I'll be speaking with healthcare innovation consultant Gary Monk. Welcome, Gary.
Hi, Nicole. Thanks for having me on.
So, as listeners of this special Frontiers Health series will know, Frontiers Health is hosted and powered by Eversana. It is a conference that has emerged as one of the premier global health innovation events, with a strong focus on digital therapies, breakthrough technologies, healthcare transformation, investments, and ecosystem development. It provides an opportunity for practitioners of disruptive health to engage in highly inspirational, informative, granted sometimes controversial, sessions and conversations, all of which are intended to provide companies, entrepreneurs, and venture capitalists with a useful roadmap, key insights, top-level learning, and unparalleled networking. To kick things off today, though, Gary, perhaps you could introduce yourself briefly to listeners and describe the journey and the passions that have driven you to doing the work that you do today.
Sure, Nicole. So Gary Monk, and I know you introduced me. My real passion is innovation within healthcare, taking technologies, observing technology, seeing what's coming next. But how can that meet the needs of patients clearly, but also carers, doctors, other stakeholders, and how we do that in a simple way? Because I get excited about technology, sometimes too much. So it's having the counterpoint of what it actually means and what it can actually do for people. So that's what drives me. I love the fact that there's so much new stuff out there, but also I think, so much new stuff is coming out. How can we actually, I don't think we often make the most of the stuff that's actually already been developed in terms of processes and how things are integrated. So I'm trying to make essentially sense of that for people, sharing content on LinkedIn. So please follow me there, but also for clients as well. How can we join things up with using new technology and old technology?
As you say, it's making sense of it all, having this excitement, yet tempering it with this proactive thought process on how to meet essentially the needs of patients. So my next question, Gary, what has been your favourite memory from a past Frontiers Health conference?
Now, that's a tricky one because there's been some great sessions I've been to. I love the startup sessions last year, that the vibrancy and the energy, but also some of the solutions across I've got to be honest, I can't remember all of them, but across a range of therapy areas, some using AI, some not using AI, but some really meaningful solutions. I love the format on the main stage, the fireside chats, the fact that it's meaningful discussion versus feeling like that I was in a lecture theatre. So I love that. And I thought Frontiers Health was a really good sized conference with really good people. So it was so easy to chat to people, meet new people and connect with them. Some people recognized me from LinkedIn, which was nice, and other people that I'd known for many years and not seen for a while and reconnected with. So I found between the sessions as well, so that was one of my favorite parts. So I think you asked me for one. I think I've given you about four, but yeah, some really great memories.
No, absolutely. This excellence in networking is something that is often mentioned in relation to Frontiers Health. And as you say, it is not a conference that operates as a lecture theatre, quite the opposite. It is about interactive conversations and brainstorming meaningful solutions. So if we turn to your own work now, Gary, in health innovation and digital strategy, can you share with us 3 key focus areas you're working on at the moment that you feel sits well with the ethos of Frontiers Health?
Yes, in terms of diagnostics, that's a core focus, not just in projects, but I publish a lot about that. And they could say digital diagnostics, but that could cover a range of different things. I've shared some content recently on LinkedIn where I believe it was using AI combined with dogs to detect cancer. So dogs can very powerful noses, olfactory systems. They've got the potential to sniff out cancer, but it was using AI to, if you like, analyze the dogs and understand their physiological responses to the different samples and the likelihood that there is, cancer there, rather than relying on the dog to bark or make a specific signal. It was more precise than that. But we could talk all day about the diagnostics. That's a focus. But to the point I made earlier about being joined up and integrated, I recently gave a presentation in Belgium around the challenges with the healthcare systems, including the US, but many others, where often we wait too late. It's the incentives within the system are often around treating sick patients versus prevention. And I think we're making progress with prevention. There's a lot of good diabetes prevention programs out there that are coming forward. So that's kind of things I wrestle with, seeing new technology coming in and the potential, but how do we actually get that implemented, get it to patients first and get people diagnosed with the constraints and the systems that we're in. So you think you asked me for three, that is one, the digital diagnostics. And the other area that's been a big focus is digital therapeutics and digital therapies. I map the space in terms of what pharma are doing, but also what other companies not related or currently not partnering with pharma are doing, and also working with clients, advising them on digital therapeutics solutions that they may want to create or partnering with other companies. And what I'd say about those is I'm seeing in terms of a trend that is they're spreading out in terms of therapy areas. It used to be mostly focused on mental health, neurology, of course, very valid, but we're now seeing them moving out into a variety of different conditions. It can be respiratory conditions, female health, I think polycystic ovary syndrome, PCOS, I think is probably easier for me. So that is a fascinating area of focus. And a current project I'm on, I can't say too much about it, but is looking at data, looking at digital health data and how that best gets shared, because whether it's diagnostics, therapeutics, all other solutions, they're very likely to be producing a lot of data. And this current project I'm looking at it's how do we share digital health data? Could be between companies, but also between hospitals. What are the best practices? What are the incentives for the different stakeholders to share data across borders? It links in with the European health data space, which is obviously a new regulation that's come out. So that's a focus, but it's more global than that, because obviously digital health data sharing is important across the world. How do we make sense of this data for patients themselves, but join that data up, benefit from it at a country, but a regional and a global level, so we can learn from that data and produce better treatments and also provide better care. So I think I've given you three there. So many more I could talk about, but they were the kind of real three ones that sprang to mind.
You have indeed, Gary. So just to sort of summarize that, digital diagnostics with its integration and implementation for the purposes of prevention progress and earlier diagnosis at that, digital therapeutics, and with digital therapeutics also we've got this move towards drug plus software discussion as well. And then, as you say, data sharing and how that's important on a global, not just regional level. Although Frontiers Health might be situated within Europe, it definitely has discussions at the worldwide level. So my final question, Gary, what is one word or phrase that, in your opinion, will define the future of health?
Yeah, the one that comes to me, and I might not win a prize for novelty, but it ties back into what I was talking about earlier, is prevention. We could use wellness as well, wellness or prevention. If I can have two words, I'd probably pick prevention. But how can we use the tools, the technology, the data, and getting the incentives within the healthcare systems to actually focus more on preventing disease before it happens, predicting it or catching it early, even if we're not fully preventing it, but preventing it getting to later and more serious stages where it's having more of a negative impact. So that would be the big thing. It's an easy word to say, but obviously challenging, because I think it's less to do with the technology, but more around the health systems and the incentives that we've got in place. But I'm optimistic we can move, back from, severe disease and treating it to get closer and closer to catching disease earlier, to prevention.
So the tools, the technology, the data and the incentives for the purposes of prevention and our future health. Let's see what the conversations hold at Frontiers Health 2025. Thank you very much for your time today, Gary. It's been a pleasure.
Thank you, Nicole. Looking forward to seeing you in Berlin.
And you.
And that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for Pharma Forum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.